All right, we have got our streaming on Facebook going live. So for those of you joining us on Facebook, welcome. And for those of you that have just now joined us, welcome. We're so happy to have you here today for our webinar on navigating the IFSP. And I have that it's right at 12:15, so we're going to go ahead and jump in and get started. So again, welcome everyone, and thank you for joining us today. My name is Stephanie McLaughlin, and I am the Training and Evaluation Specialist for Partners Resource Network. Partners Resource Network is the nonprofit agency that operates the Texas statewide network of parent training and information centers. We are funded through the Department of Education Office of Special Education Programs. Throughout Texas, we have 4 different projects, so you may have heard of us by our project names of PACT, PAP, PIN, and TEAM. Our mission here at Partners Resource Network is to empower and support Texas families and individuals impacted by disabilities or special healthcare needs. Also joining me today from Partners Resource Network is our Director of Statewide Services, Christina Henning, and our Technology Specialist, Zach Hildago. If you're having any technical difficulties, be sure and reach out to Zach in the chat box and he can assist you with those. And for those of you that are needing a certificate of attendance, you will be receiving an email to thank you for attending today's webinar. Follow the link in the email to get your certificate of attendance. At the end of the presentation, we will have a question and answer time. If you're joining us on Zoom, you can type your questions in the Q&A box at the bottom of your screen. If you're joining us on Facebook, please type your questions in the comments and we'll be sure and get them there. We are recording today's webinar, and a recording will be available on our website at prntexas.org as well as our Facebook page. So our guest speaker today is Heather Sutton. Heather serves as the Early Childhood Education Specialist for Region 16 Education Service Center. In her role, Heather provides professional development, coaching, and mentoring to pre-K and early childhood special education, or ECSC teachers. Prior to her role as the Early Childhood Education Specialist, Heather worked as an education specialist for Region 16 Head Start. Her career in public education spans 17 years. During that time, Heather has taught kindergarten through 2nd grade, and for 3 years, she served as a campus curriculum and assessment specialist. Heather's journey in education began as a private preschool teacher where she taught 3- and 4-year-olds. Heather holds a bachelor's degree in interdisciplinary studies from West Texas A&M University. Heather, I'm going to turn it over to you and let you take it from here.
Thank you very much. I'm so excited to be here with you guys today. Let me get my screen all set up. Can you see it?
Yes, we can.
Okay. There we go. Okay.
That's great.
Well, again, I'm Heather Sutton, and I'm excited to be here with you. When she asked me about presenting this, I said yes, and very excitedly, because actually, when my oldest was a newborn, I actually went through the process personally of going through the IFSP process because he was born prematurely. So as we go through this webinar today, I will be sharing maybe just a little tidbits from like my personal experience, as well as all of the information that you'll need to know to help you navigate successfully. So today our focus is going to be on what really is that IFSP and who is eligible. And then we're going to look at the actual process itself. We're going to start at the referral and work our way all the way to the service delivery, where your child, if they qualify, will actually receive services. And then what your role is as a parent and advocate. You play a very important role in this process. And so you are that advocate for your child because they're not old enough yet to advocate for themselves. So let's get started. So I just wanted to share with you some of the resources that I will be speaking about today and places that you can go back to. So Head Start actually speaks of IFSPs because in Early Head Start and Head Start, they support students through that might have an IFSP. And so they have a good place to go to. Actually, the Partners Resource Network has a great page. The Texas Health and Human Services is where you can find some information. And then as your student gets older and they get to school age, SpedTex is actually a great resource. That is from TEA, and that is a resource designed specifically for families, parents that have students that will be serviced through special education services. So you will have access to all of those links so that you can go check those out in the future. So let's start with just what is early intervention. So early intervention is available in every state. It is something that is required by law. It's outlined in IDEA Part C. And so every state must provide some type of early intervention. And when we are talking early intervention, we're talking about children from birth to 3 years old who qualify and their families. So this early intervention piece is going to be really important where everything we talk about, it's not just for the child, it's about families as well. This is a more of a holistic approach in terms of we're servicing the child, but we're also helping the people that live with the child and support the child. And this is through 3 years. And we're going to talk just a little bit about what happens after your child turns 3. So early intervention in Texas, we call it our Early Childhood Intervention or ECI, and it's the statewide program, and that's within the Texas Health and Human Services. And so it supports families as they learn how to help children grow and learn. So again, you see that big component is helping families as they help their child. So ECI is going to be our early intervention here in Texas. So let's jump in now to what actually is the IFSP and who is eligible for it. So that acronym stands for Individualized Family Service Plan. And that Individualized Family Service Plan is actually a written document. It's going to outline any of the early intervention services that your child is going to receive, and it's based on the strengths and needs of your family that you and your child will both receive. Okay, so it really stresses that family component again. And as we'll see on the next couple slides, this is what the actual plan is going to include. Okay, so the plan will include if your child qualifies, when are they going to receive the services? That's within the day, how often that support's going to be provided, what type of rotation will that be, a weekly basis, a biweekly, a monthly. So all of that will be included in the plan, and where. So when we think sometimes of receiving support, we think we're going somewhere. Maybe we're going to a doctor's office or a therapy center. But in early intervention, they really focus on coming to where the child is and where the family needs the support so that it's actually in this environment that the family is going to be in. So it's not an isolated therapy center that we only go there to get therapy, but it's not really what our day-to-day looks like. So that's going to be an important part of the IFSP. And then the how. How are you going to receive services, or who's going to provide those services for you? And so we're going to look at each one of these a little bit more in depth in just a minute. But I also want to show you these are some other things that are going to be included in this plan. And I know this looks like a long list, but every one of them plays an important part in making sure that you know what type of services they're providing and that you have really been a part of this whole process. Because remember, this is a plan that you are included in from the very beginning. This is not like someone creates a plan and then just hands it to you and tells you, oh, this is what you're going to do for your child. You are a teammate. As this is being written, you are part of that team that generates what is going to be happening for your child. So we're going to go through each one of these. This IFSP plan is going to include your child's present physical, cognitive, communication, social, emotional, and adaptive development levels, and what needs they might have in relation to each of those areas. And we're going to take a closer look at in just a minute at each of those areas so that you kind of know exactly what falls under each of those. It will also include family information, including your priorities and concerns as the family. So you get to bring your concerns that you have. You get to bring your priorities, like what is it that you're wanting your child to be able to do? The outcomes expected to be achieved for your child and family will also be included. So now that you've looked at the priorities and the concerns, now as a team, you guys talk about what is it that you want for your child? What are those outcomes that, based on the support that's going to be provided, do you feel like your child will be able to meet? It will also be included on who will pay for the services, and we'll touch on that in just a little bit as well. Um, it will always include the name of your service coordinator overseeing the implementation of your IFSP. This is your go-to person. Your service coordinator is who you will stay in contact with. They'll help walk you through the process. They will help coordinate all your services. So this person is going to be a very important person to you as the family, and you will work directly with them. And then last but not least, the steps that will be taken to support your child's transition out of this early intervention and into another program when the time comes. Remember, I stressed that this is for birth through age 3 children, but it's not that the intervention automatically stops. If it's still needed, your service coordinator will help walk you through what that's going to look like transitioning from ECI into a different type of service. So I know sometimes it might get a little confusing, the IFSP, and you also might have heard the acronym IEP. So we're going to take a look at what's the difference between these two so you clearly understand. So the IFSP that we're focusing on today is specifically for children birth to 3 years of age who qualify and their family. Okay, so this, you do have to qualify, and we'll look at what those qualifiers are. And again, this is for the child and the family. And this also includes the family's desired outcomes from these early intervention services. Remember, I mentioned that you guys are going to take a look at what the needs are and what is it as a family you would like for your child to be able to do after receiving these services. So the IEP is a little bit different. So for one, this is what takes over after a child is 3 all the way to 21 years of age if they have a disability. So the IEP is that plan that will be written to support your child. You notice here, though, this plan is specific to your child. It does not mention the family anymore, okay? Because the other part was strictly for your children who are at home with you, and then this one we're looking at school-age children. And then the other part that makes an IEP different is it includes learning goals and the services that the school will provide. So again, the IFSP is all about what type of early intervention services are you going to receive as a family in maybe your home setting or wherever it's decided that you will receive those services. But the IEP will include learning goals and services that the school will provide to your student. Again, you'll get to be a part of that committee and a very important member, and you help make the decisions for your child, even when it becomes the IEP, but it's just not home-based anymore. It's about the services they'll receive at school. Okay, so now that we've talked a little bit about it, let's look at who could qualify for an IFSP. So a child that has a medically diagnosed condition that is likely to cause a developmental delay is one way a child might qualify. So for example, this was how my son qualified for it. He was born 14 weeks early. And think about the development in a child that happens in the last 14 weeks of pregnancy. And so because he came 14 weeks early, his body was still developing as it would in the womb. So he wasn't meeting those milestones that by the time a 3-month-old meets, he still technically wouldn't have even been born yet at 3 years, at his 3-month checkup. And so because of that, he qualified because of his developmental delay with his medically diagnosed condition. And so the way the documentation that you would need to provide would be those medical records. And in many instances, especially if it's a premature birth, they go ahead and connect you directly they make a referral and connect you to ECI to help with that. Okay, so if it's a premature birth, a significant premature birth, then they might already help you put that connection in place. Another child that would qualify would be deaf of hard of hearing or blind or with a significant visual impairment. And that child would qualify for birth as well. And a team from the ISD, the district, that would include certified staff that helps support deaf and hard of hearing students and blind and visually impaired students would be part of that team as well. Okay, but remember, even when you see like a team from the ISD, this always is going to include you, the parent, as part of this team. So no decision is made without your agreement on this. And then the third way that a child can qualify is a developmental delay, a 25% delay in social, emotional, adapted, and self-help, communication, motor, or cognition. And this is going to be determined through an evaluation. So maybe you, as mom, dad, grandparent, caregiver, you're noticing, wow, I think that there might be a delay with my child. So you're going to think about meeting with your pediatrician to confirm that with the doctor, because remember, it says 25% delay. Children develop at all different rates. But if they're at least having a delay of 25% or more, then if your doctor might give a referral for you to be able to be your child to be evaluated through ECI. So here are some of those skills that are typically developed in those first 3 years that I mentioned on the slide previous, talking about this is where some of those delays might occur. Okay, so we're going to talk about each one of them. Physical. Maybe your baby's not reaching or rolling, crawling, or even walking at the expected time. Those are some things, if you notice any of those physical delays, that you're going to want to talk with your child's doctor about and get your doctor's opinion on that as well. Cognitive, maybe thinking, learning, solving problems. Are they picking up on things that you guys do together? What about communication? Now, again, this has a wide range and when we think communication, that starts with, that babbling that they do and then talking. Do they hear you when you talk? Are they understanding? So just because your child can hear the words doesn't mean they are processing and understanding what they're hearing. Social emotional is another area. Are they playing? Are they feeling secure and happy? Or are maybe they not engaging with others? Are they crying all the time and with no known cause for that? Okay, because if they're spending time with you and in a secure environment, we're going to anticipate that they're going to feel secure and happy. And so these are things that they develop in those first 3 years. And so if we're not seeing that, that might be a cause for concern. And self-help. Are they meeting those milestones of eating? Are they, as a baby, are they swallowing instead of spitting everything up? Are they starting to use their little pincher grasp to eat with? Dressing, maybe are they able to put a shoe on, or are they able to put their arms in their sleeves as they put their shirt on? So these are all things that children typically develop within the first 3 years. And so if there's things on here that you're noticing and you're like, I just don't think my child is meeting the mark, the developmental milestones, that's when it's time to talk with your pediatrician. Okay. And so now let's look at what this whole process looks like. Because remember, we said the IFSP is that written document that has all of that information. But before we even get to the IFSP, there's a process. And so we're going to talk about what that process is from the beginning, from when that referral might happen, all the way to if they qualify a child receiving services. So that first thing in the timeline might be a screening. It really depends on what the child is being referred for, if there's a screening, because some um, areas there might be a screening, some there might not. But then there's going to be that initial evaluation of the child. They're going to evaluate the child to see where they are. Are they do they have a delay of at least 25%? Okay. Did they meet that medical diagnosis qualification for a possible delay? Um, and then, or were they deaf, hard of hearing, blind, or have a significant visual impairment? So that's where those evaluations are going to come into play. Again, none of this will happen without your approval as the parent. And then there's going to be an assessment of the child and the family. This is where they want to get to know your child and they want to get to know you. And this isn't, they're not looking for like, I gotchas. They're not looking for anything negative. They're wanting to see what type of environment do you guys have set up in your home, because as they're beginning the process to possibly work with your child, they want to know likes, dislikes. They want to know how much time you get to spend with your child. Does your child get to spend time with grandparents? Is it always in the home? Is it maybe at daycare? They're just wanting to get a full picture of what your family looks like so that they'll be able to help you moving forward in the process to know the best way to support your family. And then there's going to be the writing of this IFSP. If your child is found eligible, that process will take place. Now, when we look at these things, we're thinking, wow, that's a lot that needs to happen. My child is getting further and further behind. That just seems like it's a lot. But they only have 45 days to complete all of these steps. So from the referral to the very end of writing the IFSP, there's only a 45-day window, because we know that in early childhood, children develop at a quick rate during that time. And the longer it would take for this process to happen, the further and further behind your child might be. So there is this 45-day window. So it's a lot's going to happen in 45 days, but that is to the benefit of your child, to ensure that they're getting the support they need as quickly as possible, to help close some of those gaps that they might be having. So depending on what your child qualifies for, they might receive some services. But these 4 services right here on the screen right now are provided at no cost to families. This is required by IDEA Part C, that any evaluation, assessment, the development and review of the ISP. So not just that initial writing of it, but anytime you guys come back together as a team to review it, to make changes to it, and the coordination of services, that service coordinator, those services are all provided at no cost. Now, they are more than likely going to ask for permission to bill your insurance, but whether your insurance chooses to pay for any or all of this, you will not be charged for these services at all. Now, there are a few services that are part of the family cost share. So if your child qualifies, this family cost share is the amount a family would pay for services offered, but it's determined using a sliding fee scale. So this amount is based on your family size and your income and after allowable deductions. So this is not something that you should worry about, because it's always stressed that no child or family will be turned away because of an inability to pay. Okay. So even though there is this family cost share for families that can afford to pay some for the services they might receive, They will never turn away your child, your family for an inability to pay for the services. And these services vary widely from maybe OT, PT services, maybe it's counseling services. It could be some type of feeding service. Like if your child is struggling with feeding, it might be someone who comes in and supports them and you as their family in helping them um, be able to eat better. So there's a wide range of services, and it just depends on what your child needs. And a really great thing about these early intervention services is they can be provided anywhere. They can be provided at your home. That's actually where all the services were provided for my son. At the time, I stayed at home with him because he was premature. And so those service providers would come to our house. They would engage with us in our typical settings. So sometimes maybe we would work in the living room and they would teach me things to do with my son. Or sometimes maybe we would go into his bedroom and they would actually like pull out some of the toys that he liked to engage with. And this was when he was just a few months old, but they were using what we had in our home to help me learn how to support him. So at home is where the services can be provided. A park, depending on the needs of your child, and maybe your child really loves the outdoors. This might be a setting if you guys venture to the park a lot. It could even be in their childcare setting. So maybe you're a working full-time parent and your child still needs some services. So they can go to the childcare place and they can support your child and even the teachers that work with your child there. So I have seen that happen when I taught in private pre-K. We did have a few service providers that came up and they liked working with the child in the classroom setting because they could see what was available to the child and they could make that practice time with them really meaningful because it was in the environment that that child was going to be spending a lot of time in. And so as a parent, you have a very, very important role. You know your child best. You know what you see day to day because these service providers, they're only there for a short amount of time. The evaluators are only there for a short amount of time. So any information that you can provide as a parent who spends a lot of time with their child, that's what you need to be doing. And you're your child's best advocate. If you are seeing something different, if you're noticing that a service is really helpful, if you're struggling with maybe something they've asked you to help your child work on at home, then this is your time to be that advocate for your child and for you to speak up. Okay. So first we're going to start with what if you do have concerns right now about your child? The first thing you want to do is talk to your child's pediatrician. Again, I mentioned earlier, developmental timelines can vary by several months around different areas, like walking. You know, we always see those kids who walk at 10 months, and then you see those kids who aren't walking until later. So my child, my oldest one, didn't walk till he was 15 months old because of that premature birth. He was much older in his walking. Okay. And then after talking with your child's pediatrician, if the doctor and you both feel that there is a concern, you're going to contact your ECI program in your community. This is going to be, remember, this is where we get that referral started, and they have that 45-day timeline to do the evaluations, to do the assessments, and then if your child qualifies, to get that IFSP written. I know that IFSP sounds like it has a lot of information and it's really daunting, but really it's just about what they're saying they're going to offer, the outcomes that you're wanting to see. I know one of the things that was part of our services that were provided were when the OT would come to our house and she would show me how to help him. We were trying to help him learn to sit up. and she would use some of his toys to, put in front of him to engage him and things like that. But she took pictures of what those poses and different things look like for me to have. So when she's not there, I'm actually getting to be the one to support my child. And so that's a huge part of the early childhood intervention. It's not just about the one time they come each week or however often they come, but it's actually giving you the tool as the parent to be able to support your child all the time, even when they're not there. And we mentioned earlier about the service coordinator. So the service coordinator is that person that's your primary point of contact through this whole process. When you have concerns, when you have questions, they are the person that's going to be there to answer those, to guide you, to connect you with the right services. But I really want to stress this, that none of this is going to happen without your written consent. It's not even just verbal consent. So don't feel like, oh, I said that, but maybe I've changed my mind. Nothing's going to happen unless you give your written consent. So if you have questions about things, feel free to ask those questions, because until you give that written consent, they can't move forward with anything. And so none of this is going to be done without your approval in this process. This is something I really, really want you to take heart. As a parent, you are an important member of this team. I can't stress that enough. You are the one who spends hours, countless hours with your child. You know them, you know what's best for them. And so it's going to be so very important through this entire process that you advocate for your child and for your family. Because remember, this is a family-based program. And so you're advocating for what's best for you as an entire family. Here's a little bit more about that service coordinator and parent collaboration piece. So the service coordinator is going to be like your case manager, and they're going to help you incorporate activities into daily routine that support your child and your family. That's why they like to come to your home or to the daycare, because what services they provide, they're helping incorporate that into your daily routine, what you do with your child every day. They're also going to help you access support services and resources. So maybe they noticed that maybe there was a service missing that maybe you are seeing now that might be something that your child would benefit from. This is when you collaborate with your service coordinator and you guys have those discussions. Your service coordinator is also going to play a huge part in helping you with the next steps. Remember, I told you this is birth through age 3, up to age 3. If your child still qualifies, then your child would transition into special education services or some other option after age 3. So depending on your child, some children may need services past 3 and some may not. So for example, my son, he did not need the services after about 18 months. So those services were stopped. Other children that I know, their services continued, and when they turned 3, then ECI was able to connect them with their local school district and help them move forward with developing a plan. And then that's when that IEP comes into place. It's not the IFSP anymore, it's the IEP in the school. But it doesn't always have to be special education services at age 3. It could be that your child is transitioning into just a public pre-K. Maybe they're headed to Head Start if you have that available in your area. Maybe they're continuing in childcare, or you guys have decided to do some kind of home learning, homeschooling. And so that service coordinator is there to help you plan for what's best for you and your child in those next steps. So really lean into utilizing that service coordinator, and again, just be such a strong advocate for you and your child. So I'm going to ask Stephanie how she wants to handle this, but I am open for questions now. So.
All right. So Thank you so much, Heather, for all of that information. Really useful and helpful. So if you're joining us on Zoom and you have any questions, you can type those in the Q&A box and we'll be sure and catch those. And if you're joining us on Facebook, if you type them in the comments, we'll catch those. And we do have one question for you, Heather. If you suspect that your child may qualify for ECI services and you want to pursue that, how do parents know where to go for that since it's before school age?
Sure. So starting with your pediatrician is a great place to start because they can actually give you that referral and connect you. There's also an ECI community locator actually on the ECI website that I linked in this presentation. And so you can go there, you can enter in your community, and it will provide the information for you how to get in contact with them.
Excellent. Thank you so much. All right, let's see if we've got any other questions. While I'm looking for questions, I'm going to post that ECI locator link in the chat as well. Right, I'm not seeing any other questions. We're going to give you just another minute. If you've got any questions, feel free to type those in the Q&A box or on comments in Facebook. Any other questions? You did such a great job, such thorough, good information. So thank you again for joining us. Really appreciate it so much. And thank you for taking time to share your wealth of knowledge on ECI and that Individualized Family Service Plan. So we're going to wrap up a little bit early today if there are no more questions. So Heather, I'm going to go ahead and share my screen and we're going to wrap up. All right. Again, I want to thank everyone for joining us today for our webinar on the Individualized Family Service Plan. As a reminder, that if you are needing a certificate of attendance, you're going to receive an email to thank you for joining us for today's webinar. Follow the link in that email and you can get your certificate of attendance. The webinar was recorded and that recording will be available on our website at prntexas.org and it's also available on our Facebook page. Be sure and check out our website and our Facebook page for more upcoming webinars. And so I'm going to share a little bit with you. Tomorrow, actually, we have a webinar on November 5th with Nathan Pullen from Texas Education Agency on understanding the autism supplement. And then we're going to wrap up our fall lineup of webinars on December 2nd with Elizabeth Danner from Texas Education Agency. And she's going to be joining us to talk about My Life, My Voice, Student Involvement in Planning for Adult Life. So be sure and check out those webinars. As always, all of our webinars are free of charge and open to anyone. All right, on the screen right now, I've got contact information for our Director of Statewide Services and myself. So reach out to us if you have any questions or if we can help in any way. Be sure to check out our website again at prntexas.org for information on upcoming webinars and even events in your own local area, as well as lots of information for parents. And like and follow us on social media on Facebook and X at prntexas. Heather, thank you again. I really appreciate you taking time today to join us and sharing your information. And thank you all for joining us. I hope you have a wonderful Tuesday and we'll see you next time.
Thank you.